So I had like a little mini heart attack because and he's like, "What's wrong?" I'm like, "Well, I don't know. You tell me." Skydiving accident.
I mean, I'm fine. So what happened? We were going up in the plane, and as we were about to open the door, dude said, "Oh, we have 2 thunderstorms converging on our area."
So quick.
Yeah. And I'm already strapped to him. I'm sitting in this man's lap. And, like, we've become really good friends at this point. And I look back and I'm like, "Do you think it's still safe to jump?" And he said, "Well, yeah, if we go in the next minute or so." I'm like, "Okay." So we open up the door and we jump. And then right as soon as I can see the ground out of the clouds, he pulls the chute. Spend way too much time in the air. And then he brings us down pretty quickly. And as we start to come down, with tandems, you bring your legs up to land. You scoot in on your bottom. And so I brought my legs up, and right at that time, the wind just cut. And it was like a good 10 to 15 foot drop, just straight down on him,
your tailbone.
Essentially, his legs on my tailbone.
Oh man, what happened to the other guy?
He was fine.
Oh, he was okay?
I couldn't breathe. Like, it knocked the breath out of me. And so they were like, "He signed the paperwork, right? Like, all the release of liability and that." I'm like, "Okay, guys."
Well, I'll just cross that one off my bucket list. I don't want my poor tailbone. So is it just pain in the tailbone then?
So no, I actually have pain
in the lower back?
In the lower back. A lot of that probably has to do with the fact that I lift on really heavy patients a lot. Everybody's always like, "Oh, he's a guy. Call him to help you lift." So that's part of that too, but it only started after the skydiving accident. And it's always been a consistent pain, right in this area. Speaking of posture, though, I remember him mentioning, like, "Oh, she's really, like, sticking her butt out." And when you said that, I was like, "Yeah, that's the posture I really want." Like, I need to be able to, like,
Yeah, you gotta be able to lunge down into it. Because if I do this, I'm gonna blow my back out.
Yeah.
I'm rounding.
Mm-hmm.
You have to, yes.
Give into it a little bit.
Yep. Oh, this is tight.
That right side stays really tight.
Yes, I can tell. I see that. Side feels pretty good, except at the very, very top. Oh. Wow, that's tight. How much are they asking you to lift?
I mean, for example, I had a patient. I just now started this contract. Before this contract, I had a patient for about 2 weeks straight that was 400 pounds. And it was me and a little old lady that would have to move her.
This is like a rock.
Mm-hmm. That's a lot of where my lifting force comes from. I can't bring it from my legs in certain situations because I got a vent and IV pole.
And then there's some spasming over here.
When I'm driving, it's like I'm leaning this way a lot.
So you feel relief when you do that?
Yeah. And of course I have to switch, after like an hour or so if I'm driving, I'll like come over here and it's like, "Oh, that feels good." And then it starts to hurt again. I'll like back to here for another hour.
Okay. All right. Let me see if I can't pinpoint it, at least for you. I mean, I don't know how much it will help. I think it will feel relief temporarily, like for a few weeks.
Yeah.
I'm hoping a couple months. Mm-hmm. But like I said before, it comes back.
Of course.
So you gotta constantly be training and training yourself to go back. We'll teach you.
Okay. Awesome.
How to do that. On your back, face up for me. Whew. That's it. Breathe. Shh. That was my elbow. That's it. I know. Oh, too much?
No, my arm wants to go this way. I don't know.
Go ahead. That's it. hanging on edge. It's like, help me. Oh my. Did you pop it already? Is it? No?
I tried not to pop for like 3 days.
Okay. I'm just checking. Okay, I don't want to be overly aggressive if there's nothing there. That's all I'm saying. Because I got to do that. Okay. Right here. Excellent.
Kelly Clarkson.
There you go. Other side.
Oh, yeah. Oh.
Yeah. Hi. Crunchies.
That's nice.
Let me just get the rest of this neck. That was my wrist. That wasn't you. Yeah, right here. This is what I'm talking about. It might be a little nervy here.
Okay, so I have a story for that one.
Okay. Because I placed my hands on it and went, ah!
Yeah. Several times, just the last time, but they've all been very similar circumstances. The last time there was a bee left to the left of me, and I looked left really quickly, and I could feel like the top part of my shoulder went numb all the way up my neck and into my head where you're touching there. The back and the side of my head right there. Mm-hmm.
So the bee didn't sting you?
No, it didn't sting me at all. It's happened 3 times.
Oh, so you turned to the left. To the right?
The bee was on the left, yeah. So I was turning left.
Okay, because eventually I know that this will stop tingling. If I can free that casing.
Mm-hmm.
How's he doing?
He's doing good, yeah.
There you go. Mean. Epicranial nerve. There you go. Okay, let's adjust this left side, okay?
Mm-hmm.
Perfect. Excellent. Okay, I'm just going to leave that there. I'm done fiddling with it. Ooh, very good. Now we got the rest of you to do. See, the hip almost wants to go before the ankle. Oh my
I don't
goodness.
think I've ever felt my ankle pop.
What are you doing to your poor ankle? It don't want to go. I'm not gonna, and I was 160 pounds of force there. I don't know how much more force I'm gonna put in that poor ankle. All right. Bend. All right. Hip. There it goes. Perfect. All right. Come on in, sit up, feel the neck. Take your time. All right. How's the neck feel? Just take that around. A little better.
That feels great.
Okay. We're gonna go shirt off on your stomach. I needed the.
All these little cracks on
I
the
know.
nerves of my feet.
Ooh, got one.
Mm-hmm.
All right, you ready for this?
Yeah.
Here we go. Take a deep breath in. Oh, yeah. That's it. That was nice.
Yes, ma'am.
I was like, ooh, finally. Deep breath in.
Sorry, I took a deep breath.
We got more. That was good. That should feel good. Me next. Deep breath in. And, oh, nice. Good job. Very trusting. You really trusted. You let me in. That was good. Oh. Okay, oil now, okay?
Mm-hmm.
You have same kind of thing. A little lower.
Mm-hmm.
This is where your problem is as well. Right here.
I can feel that. Oh,
Slightly
that's nice.
slightly different. you know, but it's definitely there. Because now I'm going to go on a different level on him. Go here. It's okay. I know stuff is going to crack like that. It's just scar tissue. So this is from the fall. You know, it just rippled up the back.
Yeah.
That's it. It's a tickle. Okay. Sorry. I'll go the other way. Just tell me if this tickles, okay? All right. Well, we just switched to pain. We just keep going. We bypass. There you go. And yes, I'm sticking my butt out. I'm keeping a curve in my back. I feel like when my back gets tired, I'm like, nope, go the other way. Crack that side. Come over here while I'm adjusting the patient. Crack that side.
Yeah. Love it.
Just push. Okay. Ooh, it's intense. It's intense. Right here.
Come to work every day in yoga?
Well, I can't do this in a suit.
No.
I'd rip the
No.
suit. Like you said, $5 Target clothes. Perfect. Yep, because if I'll feel horrible messing up my outfits. Okay. Right here. Especially since you said no pain in the tailbone though?
Not directly in the tailbone.
Right there.
Yeah, on the left there.
All right.
And they said my coccyx was turned
Oh, everybody's is.
in.
Common when you fall on it.
Yeah.
By that point, that's just, they call it the cauda equina. It's the, oh, what is it called? Oh, phylum terminale, like the final filament, right down there at the end. So the coccyx is important. It's the cause of a lot of people's lateral curvature. That's why some chiropractors only work here for a reason.
Do I have a curve in my spine?
Yes,
Okay.
right here. You're normal. It's everybody. We back off right here.
Yes, a little bit.
Higher? Really?
Yeah, a little bit lower, maybe.
Like
Yeah.
down here, I would
Yes,
think.
yes,
Okay,
yes.
okay. How about now?
It,
Is it zinging you?
no, it's not zinging.
I'm trying to break it loose. I don't want that, but here we go again. I don't want to slice it.
Yeah, yeah.
Don't ever let anybody hold that.
Yeah.
That's why you gotta tell me. Good, you tell me.
Okay.
I don't need to be. It's kind of like the same thing in your neck when it went up to your eye. Same concept. They're not that deep. Still going down your leg?
No.
Okay. Let's test it again.
Better.
Okay.
Way better.
Okay. Now I'm just gonna go with my elbow if that's okay on those SI joints. I'm gonna
You
be
can
right
try
here.
anything, yeah.
All right. I'm just letting you know. Yes, no, maybe.
I know it feels good. It's just different.
Here's your SI joint right
Yeah.
there.
Yeah.
Trying to help release that joint because I'm going to adjust it.
Yeah.
That's pretty good. It's not resisting me. You're letting me,
Yeah.
get in there.
Well, see, I'm from the part of Virginia that no one ever recognizes.
Oh, really?
Southwest Virginia, which is like the bird's beak.
Whew. Well, you're very red, like a lobster.
Yay. I'm gonna
Yay.
set it as my background on my wallpaper. You don't understand, I'm a nurse. Like, this stuff gets me off, basically. I can sit there and watch, like, people pop pimples and go to bed.
Oh!
Sandra Lee.
No, we enjoy this stuff. I'm like, okay, where else can I search for more? Gotta fill in all the lines. Fill in all the blank spaces. This will be all gone in a couple days, okay? The body heals pretty quickly.
I'm gonna go get a tattoo of it.
No! No! Don't you dare. I will feel so bad. We'll take a picture, okay? You can have that as a souvenir, okay?
Yeah.
Oh, yes.
It's a lot.
That's beautiful. I love that. And anyone who thinks that they can't stand that was, I mean, you were kind of digging in a little bit, right?
Yeah,
That was
obviously.
easy. That's easy.
Yeah, I was actually scared it was gonna hurt, and it did.
Well, it sure does look like it.
It does look like it.
You're gonna see it for about 7 days on his back as it slowly disappears. But yeah. See, the light pink will go away. Like this mark I made here, that's like if I scratched you or something and it will go away. These dark spots are what...
And that's, you said adhesion?
I think it's metabolic waste.
Okay.
But unless we suck it out and send it to a lab for you to analyze, I mean, you're welcome to try to do that for me.
Fine.
Could you tell? Could you tell?
Mm-hmm. You absolutely could, yeah. You
Because
could,
like nobody's done it.
if you could get a sample from the area, yeah, you could do like a.
Could you tell
chemical profile.
what that is?
Mm-hmm.
Because
I've got
nobody
enough
has
area.
done it. Yeah, can you?
Yeah.
Could you suck that out of them? Are you licensed to suck it out?
Yeah. I wonder if we could get enough. How cool would that be?
What kind of,
Because nobody.
what kind of sample are you
Like, just I don't need to take the I don't know I don't know. Could you suck it out?
I'm gonna ask the pathologist tonight. I'll show him my back and be like, "What do you think? How could we sample?"
Like, is there any way to tell? Because we know basically only one thing is that it increases range of motion.
Mm-hmm.
So sure, it breaks down an adhesion. Okay, so you have an adhesion like this. There's going to be stagnation. So I bet the only thing you'd find is red blood cells.
Maybe, but
You'd be surprised.
when you do like mass spectrometry on something, it'll read every chemical compound in it.
Like, turn the camera towards him.
It'll read every chemical compound in the tissue, so you could see every breakdown of everything.
What's in metabolic waste? It's just
It
dead
depends.
cells.
I mean, it would be like metabolic panels, so you're going to see like sodium, potassium, urea, I mean, all these different chemical breakdowns. But then you could even go further, you could see like tyrosine and more advanced like metabolic chemicals.
Because it's some sort of stagnation. Because I can feel it. It feels like squishy fluid. And then as I scrape it, it goes away. It comes, excuse me, too much laughing, into the skin, and it's no longer down in that deep layer.
Yeah.
So it's something. Now they say I'm just breaking capillaries. Yes, but why is it breaking? Is it because I'm actually scraping it and it's breaking? No, because I'll scrape somebody and nothing comes out.
Yeah.
So if it was the tool breaking the capillaries, then every single person should bruise.
Yeah.
But they don't.
Everywhere that you scrape.
Everywhere
Some
that
people
I
don't-
scrape.
They don't over here, and then they've got a problem over here, and it's like purple.
It just comes out.
Yeah.
So, but nobody has really, unless you can find a study, unless you're in a different, like maybe you're in a different realm of research than where I go.
Mm-hmm.
But I have never seen anybody take a sample and actually tell us what it is. Let's prime those neutrophils. on your back. I'm going to do the pubic symphysis. Bend your knees for me. And press out against my arms. 5, 4, 3, 2, 1. And squeeze. Oh, a little less for me.
Nope.
It's okay, it's okay. And squeeze. There it is. Perfect. I know, it's a weird one.
That's great.
Hands on your hips. We're going to do some more neutrophil priming. Elbow back against my hand. Excellent. And lean away. Good. Good. We're going to do the shoulder first. Sit up as straight as you can. And then elbow back. Woo, nice one. You're very easy to cut. You know the drill. He's just like, yes. I didn't have to coach him. He just knew. Lean away from me. Perfect. Okay. You want your ears?
Yeah.
Okay.
Where you want?
That- Lean away. Like that.
Yeah, that's.
It's fine? Okay. Okay, that's all I'm going to do there. When my brother did it to the first time, I was like, whoa, okay. And lean away. Ooh, nothing there. That's good. That feels good. A little bit there.
Oh.
Tiny little bit on the back. Good, good. Anything else? I think I got it all. I know I popped everything.
Yes, I think you did.
The only thing we haven't done is the stretch.
Yes.
Then you just lay on it. Same exercise.
That was so releasing for me. It felt so good. I loved it. So I have a solution. So you can do what's called immunohistochemistries. So they'll probably take some scraping on the skin later tonight, and then they'll send it through these different histochemistry, like chemical stains, that'll show the metabolic breakdowns. I think we can do that, and right in my lab.
Can you tell where it's from?
Well, it'll depend very much, like,
If it's muscle or if it's...
yeah, so you'll know because red blood cells are erythrocytes, but then you have myoglobin, which is the breakdown of blood in the muscle tissue.
Ah, that's
So, like right now, like if I went and peed and then did a urinalysis, it would show that I had blood in my urine, but I don't. You worked my muscles, so I'm releasing myoglobin through my kidneys. Yeah. So a buildup of myoglobin can be unhealthy.
Don't get a urinalysis right afterwards.
Yeah.
Something's wrong. No, you just
Yeah.
Dr. Mondragon, that's all that happened.
Any lab person would know, like, you
you
can
would.
differentiate myoglobin from hemoglobin is what we typically would call red
So
blood
you
cell.
would know, like, what was pathological and what would just be a normal massage.
Yeah.
Okay.
So most likely what we would find is called inflammatory myopathy.
Okay, we're gonna have arms out like this, and this is how you get off. Roll to the side. Relax. Yes. You did it. You did it.
Thank you so much.
So in inflammatory myopathy, where you see bruising after massaging, you have a huge release of human leukocyte antigen 1. But
It's just your own body. You know what? I can't pull out anything that's not already there.
yeah, basically that's saying it's pulling out the inflammatory markers. So if it's pulling out HLA, it's pulling out C-reactive protein, it's pulling out all these antigenic compounds that have built up in your muscle tissue. So by releasing it into the petechiae, it allows the spleen to reabsorb that and then take it away.
I mean,
through the waste.
that's what I thought.
Yeah.
Your skin is your number one defense, and people think that's because it's on the outside. It's not. It's because it's both outside and inside, and so your skin's gonna reabsorb that anyway. So you're taking all the shit out of a muscle and putting it into the skin.
Yeah,
It
let
can
the
just shed
skin
it.
deal with it,
Yeah,
right?
it can just shed it.
Yeah. You shed it, or you have myelocytes. They are the cells that eat the things out of your skin, like petechiae. So they'll eat it, and they'll actually swim back to the spleen and drop it off. It'll break down and cull there, and then you'll release it in your stool or urine.
That's what I mean. I always tell people, please drink a lot of water afterwards, because I know that if you drink more water, you'll be less sore.
Yeah, because you release more myoglobin. It doesn't stay in your body.
I've been saying the right thing all these years.
Good job. Integrated medicine. I love it.
It was a theory. You know, I was like, well, I assume that we're pulling it out, letting the skin deal with it, and then you drink more, and then you just pee it out. You know.
Yeah,
That's
it's a very simplified way of saying everything he just said.